Okay, well, there's our cue to go ahead and get started. Welcome to the Institute for Disability Research Policy and Practice, Early Intervention ECHO. We're thrilled to have you join us today to hear about this amazing topic. We are recording today's sessions. We do store those on our Canvas page as well as our YouTube channel. So by joining today's session, you are consenting to be recorded. Please don't hit that leave button, but if you have issues with being recorded, you can go ahead and disconnect from today's session. Key components of an echo session. So we have a subject matter expert. Today we get to hear from Ashley Stuart, who is going to be talking to us about typical behavior, which is just a great addition to our typical behavior series that we're going over this year. Then we'll have a case presentation and we break out into small breakout rooms where we discuss it because everybody on this call has such amazing ideas and resources and information and different perspectives. So it's always great to hear everything from that. And that just adds to our professional networking. It's always good to know that we're not out here doing all this work independent, and there's people that we can reach out to. We love interactions, so if you have any questions or concerns or anything, you can put those into chat and we'll make sure those get answered. We love case narratives. It's a great way, like I've just shared, to get information from all the amazing people on this call and brainstorming those families or clients that we're working with that we just need a little bit of ideas of what to do next. So again, we love to see faces. It's always easier to present to faces on a screen than black screens. So if you feel comfortable, turn on your camera. It just builds that networking and connection with each other in a virtual world, as well as, raise your hand to ask your questions. We have some great people on this call that your question would probably be able to get answered. We do talk about sensitive topics, so of course, de-identify any information. If you have questions about that, reach out to one of our hub members. They all have an asterisk in front of their name, so they're easier to find on chat. You don't have to go scrolling through everywhere. In order to get a credit of attendance, we do ask that you fill out that survey. The survey is just a way that we can take the information back to our funders to share what is happening in these echo sessions. We also utilize your guys' information to guide any curriculum changes or topics or things that you guys want to see happening in these ECHO series. So add your suggestions and your favorite parts or topics that you would like to see happening. We do take those into account as we are doing any planning. Canvas is where we store all of our information. So recordings, handouts, resources, all the recommendations that you are free to access at any time. If you want access to our Canvas page, please email earlyecho@usu.edu and we will get you instructions on how to register for that. Just another plug for those case studies, those case discussions, whatever you want to call them that makes it a little bit less scary to present that. But it's just a great way to get information and feedback that you can take back and apply from everybody on the call. So we do have social media. If you've not followed us on social media, take a minute to do that. We share information about upcoming sessions, things that are happening around early childhood. So I'm going to go ahead and stop sharing and turn the time over to Ashley. And Ashley, there you are.
Okay, perfect. All right, let me get my slides up. Oh, and now Zoom wants to make changes. 1 second.
Oh no,
Always.
exactly.
There you go. Okay. Well, thank you for having me today. My name is Ashley Stuart. I am a child and adolescent psychologist and associate professor in the Department of Pediatrics at the University of Utah. I work in the developmental assessment clinic under general pediatrics. My primary role as a child and adolescent psychologist is to assess atypical development. But it sounds like what has really been emphasized over the course of this series is how, in order to really know when development is deterring from typical, we have to have a good understanding of what is typical. So, my talk today is really focused on typical behavior and understanding when things like the terrible twos are more than just the terrible twos. Um, so a few objectives that I hope to cover today over our time is to first just give some context for the development of behavior in toddlers. We'll then dive into some of the most common challenging behaviors that we observe in early development and talk about when these behaviors might be cause for intervention or for additional referrals. And then wrap up today with describing some strategies that you can share with caregivers that you work with or that you encounter on how to manage these challenging moments. So, as a parent, I think when it comes to parenting children in their early developmental stages, especially the toddler years, the question we often find ourselves asking is, this is a period of really big feelings. When are these big feelings that my child is experiencing more than just a feeling? Meaning, how do I know and when do I know if I should be concerned about the behaviors that my toddler or these feelings that my toddler is displaying? Um, within early development, sorry, I just need to switch my screen here. I apologize. I just lost the meeting. So 1 second. I know I'm probably here, but I have
You are here, yes.
lost vision. I think it is this. Okay, there we go. Am I still there?
You're still here. Yep.
Okay. The fun stuff, right? So, first, I would like to talk about this idea and this concept of challenging behaviors. The AAP, or the American Academy of Pediatrics, their 2026 clinical report on healthy mental and emotional development really emphasizes that behaviors that we commonly label as problematic or challenging behaviors, specifically behaviors like tantrums, defiance, even separation distress or anxiety, are often a part of healthy development. And it can be really helpful to reframe those behaviors in that way. For example, when we're thinking about things like temper tantrums during the toddler years, those can be explained often as a form of communicating feelings. It's a process that's really helpful in the development of self-regulation when it comes to emotions and feelings. And most challenging toddler behaviors that we see are transient. They're also developmentally expected. and they reflect the child's emerging autonomy, limited language skills, and their immature prefrontal cortex. They're not necessarily pathology. So, to give some developmental context, if we think especially about the period from 15 to 36 months, it's really defined by the emergence of autonomy. And this is that drive to act independently, make choices, and exert control over the environment. During this period, children are really realizing that, hey, I'm different than my mom. I'm different than my sister. I'm different than my dad. And so, when we look at healthy mental and emotional development, we see this development of autonomy and desire for attention with accomplishments as a really core social emotional milestone, especially in that second year of life. This extends into the third year of life, so between 24 and 36 months, with the addition of the awareness of others' feelings, parallel play, as well as magical thinking. Toddlers are also really fundamentally egocentric. They can't really take the perspective of another person yet. In fact, when we think about the ability to understand that other people have beliefs and that those beliefs that other people have are different from the beliefs that you have or from your own thoughts and feelings, essentially the concept of theory of mind, that typically doesn't emerge until children are around age 4. Um, this is typically observed when children start to pass things like verbal false belief tasks. But really, before that, toddlers operate with a nonverbal implicit system for tracking others' behaviors. But it's not the same as understanding that another person's desires or knowledge is different from their own. There is a link, in fact, for infants who engage in early social communication skills, specifically infants who initiate joint attention more, so where they share experiences on other objects or events in their environment. They tend to show better understanding of the mental states of others as preschoolers. So there is kind of this link between early social cognitive capacities as being precursors to more mature perspective taking. Um, Lastly, impulse control is something that's essentially absent in toddlers. It really develops fairly gradually and develops gradually along with other executive functions like cognitive flexibility and working memory. While there is significant growth in these aspects of executive functioning between 13 and 28 months, there still are very rudimentary or elementary processes in toddlerhood. So, all this is really to say that when you see a 2-year-old take a toy from another child, like you're seeing in this picture here, this is really reflective of the convergence of strong autonomy drives, as well as some egocentric thinking and that near absence of impulse control. It's not necessarily reflective of willful defiance. One of the most powerful drivers of toddler frustration is actually the mismatch between receptive and expressive language. Toddlers understand a lot more than they can say. And in fact, when we look at studies of late talkers, children between 12 to 38 months who have less expressive language often demonstrate more severe and more dysregulated temper tantrums. In fact, late talkers, specifically between 24 and 30 months, had a relative risk of severe tantrums almost 2 times greater than peers with typical language. Stronger language skills have also been associated with fewer disruptive behaviors such as irritability, aggression, and noncompliance between 18 and 36 months of age. So this is to say really that this language to behavior link is bidirectional and dimensional. Toddlers who have language delay, both receptive and expressive, often have significantly more concerning social emotional behavior between 18 and 24 months. Okay. Children who have receptive and expressive language delays are also often more substantially delayed across all developmental domains and more likely to have pervasive developmental problems. But in addition to the language behavior link, there's also a link between language and executive functioning connection. Toddlers' vocabulary, for example, is significantly associated with their acquisition of inhibitory control and cognitive flexibility, suggesting again that language is kind of the scaffolding tool for developing that skill of self-regulation. So, this is all really to say that when we think about this period of the terrible twos, they really are in large part a product of this gap in language. The child knows what they want. They have this fundamental understanding of what it is that they're seeking. They also understand what's being denied of them. So they know when a parent is telling them no. But they're lacking that expressive tool to be able to negotiate or to explain or to request in a different way. And as we just talked about on the last slide, they also lack that inhibitory control to be able to wait. Emotion regulation is another big piece of early development of behavior. And in fact, when we think about the ability to regulate one's own emotions, which is essentially recognize the way that we're feeling, and then be able to employ the appropriate coping strategy to manage that feeling, there actually is a neurobiological basis for the reason that toddlers don't have great emotion regulation skills. And that is because their prefrontal cortex, essentially the part of the brain that really manages all of those executive functionings, is profoundly immature. And in fact, this persists well beyond the toddler years. As many of you may know, the prefrontal cortex is one of the last aspects of the brain to fully mature, and it actually remains pretty functionally immature through the mid-20s. So toddlers really aren't choosing to have meltdowns. Their brains literally lack this hardware to regulate their strong emotions independently. And so when we talk about needing to rely a lot on the emotions and the behaviors of others, being able to watch other people regulate, or how toddlers often seek out assistance when they're feeling overwhelmed with their big feelings, this co-regulation that they seek out with caregivers is not a luxury for a toddler. It's actually a necessity for them because it's something that their brain just doesn't quite have the ability to do independently yet. When we think of challenging behavior, by current estimates, about 13 to 20% of children in the United States have some sort of behavioral or emotional disorder at any given time. And nearly 50% of toddlers who have emotional or behavioral challenges at about 12 to 40 months show a continuity of problems a year later. And early behavioral problems tend to predict long-term outcomes, including externalizing disorders, depression, substance misuse, and delinquency. So this is really framing why it's so important to know the difference between when we have behavior in toddlers that is more clinically indicative of a persistent long-term problem versus a behavior that might be more reflective of typical development. So let's dive into some of the most commonly observed behaviors in early development. We'll go through on the next several slides here a range of behaviors that you all have likely encountered in the past or maybe presently going through with toddlers of your own in your home. And these often are behaviors that are brought up when a child is coming to me for a developmental evaluation where there are some concerns about a child's behavior as well. So let's start with temper tantrums. Um, I don't know if any of you are fans of the probably now very outdated, but I think very interesting meme trend of reasons my toddler screamed at me today or reasons my toddler had a temper tantrum today. But this picture illustrates some of the reasons that we see temper tantrums, which are really for fairly irrational reasons in our adult brain. This one in particular, my child screamed at his balloons for an hour because they wouldn't stop floating, and that's why he's having a temper tantrum. Weekly tantrums are not unusual for children, for young children. In fact, they're pretty universal in the toddler years. About 84% of preschoolers are going to have tantrums at least sometimes. However, daily tantrums are going to occur in a smaller subset of preschool age children and occur really only in about 10% of children. Um, Daily tantrums is also a threshold that we think about when we start to differentiate whether or not these tantrums are approaching a more challenging behavior where intervention might be considered. When we look at the progression of tantrums over time, in a study of 861 children between the ages of 1 and 5, it was found that tantrum frequency generally declines across the 1 to 5 year age range, whereas the duration of the tantrum sometimes will increase. And there were three specific behavioral profiles that were identified. Low intensity tantrums, which occurred in about 26% of children, moderate intensity, which captured about 32% of children, and high aggressive or self-injurious tantrums, which would occur in about 42%. And in this population, those more frequent tantrums really predicted the long-term externalizing problems. And specifically, longer duration was found to predict internalizing problems, as well as those high aggressive self-injurious profile predicting adjustment problems above and beyond frequency of duration. Most common triggers that we see in temper tantrums are, of course, being told no, having a desired object taken away from them, certain environmental circumstances like being hungry or tired, as well as transitions between activities, especially when we're transitioning from a preferred task like playing with toys to having to comply with a demand like putting on your pajamas to go to bed. So, when we should think about being concerned about temper tantrums is, like I said, across several different aspects of the tantrum. So, if we look first at the frequency of the tantrum, again, tantrums are going to happen. So, they're not that concerning when they're happening on a more infrequent basis. But when we're having a pretty big tantrum every day or even occurring several times per day, that can be an indicator that there might be some time to refer for some extra support or intervention. Another thing that we want to think about is the duration of the tantrum. So, when a parent tells me that their child is having tantrums that are, more than 25 minutes long, or they're having a really difficult time recovering from the tantrum, so essentially the parent is trying things to distract or reduce the temper tantrum, and all of those efforts aren't really resulting in the tantrum reducing. Again, this might be a time for some intervention. The context is also something that matters. So, tantrums that seem to not have an identifiable trigger or occur just out of the blue can be additionally concerning, as well as what the tantrum is composed of or what the content of the tantrum is. So, when we have behaviors that are going to cause injury to the child themselves or to someone else, so engaging in self-injurious behavior, destroying property, or being aggressive towards others, those are also things that we might be concerned about. Pervasiveness. In typical toddler tantrums, we will sometimes see them more at home than we see them in other settings. Or when a child's environment is significantly changed. So when the child is in a new setting, that might lead to a tantrum. But when we're seeing tantrums happen across multiple settings, so when the child's home, when they're at daycare, when they're with grandma and grandpa, when they're with aunt and uncle, when they're with their favorite babysitter, those are times as well when tantrums are a little bit more concerning. And then, of course, the trajectory. As I mentioned before, we should see an improvement in tantrums as a child matures and they develop some of these abilities to regulate themselves and their behavior. So when we see tantrums really failing to decline, so they're starting really intense and they're staying really intense over time, and especially as they're entering that fifth year of life, so approaching 4 years of age, that might be another time when we want to be concerned. All right. Next behavior, defiance.
Yeah, it's time for bed. Yes, it's time for bed. Yes.
So defiance starts early. This is a video actually of my daughter at about 10 months of age, defying going to bed, shaking her head very clearly when it was time to go to bed. She loves this video. But essentially, oppositional behavior or saying no in toddlers really is reflecting this emergence of autonomy. And this is really linked, for those of you who are really into developmental psychology like myself, to Erikson's stage of autonomy versus shame and doubt. And that particularly comes pretty strongly between 15 and 36 months of age. So again, where that toddler is really recognizing that they have their own thoughts and feelings and that they're independent from others. Defiance is oppositional and defiance is oppositional. Defiance is nearly universal. And I often talk with families about, like, when we're setting goals around defiant or non-compliant behavior, that it's not really realistic of us to set a goal of having 0 instances of defiance or non-compliance. I think there's a pretty strong argument to be made about across just about every one of us that if we were to look at our day, we're likely not compliant 100% of the time with the things that are asked of us. So, especially expecting that of our youngest is probably setting the bar a little bit too high. We'll go into this a little bit more, but essentially, when we think about managing defiance, some recommendations are doing things that really support that emergence of autonomy by providing those things like opportunities and choices, encouraging independence, and protecting from constant failure. But of course, how do we know that it's normal defiance versus something more pathological like an oppositional defiant disorder or ODD? Well, again, kind of taking that similar framework that we did when we looked at temper tantrums, we want to first think about the frequency and the persistence of the behavior. So, when we have normal defiant behavior, it's going to be intermittent. So, sometimes the kid's going to listen to you, sometimes they're going to say no. It also might depend on the context. Maybe that defiance is more around going to bed, and less so about doing things like having to go pick up your shoes. When we think about ODD in particular, we're looking at a pattern of behavior, and that pattern typically is occurring for more than 6 months at a minimum. There's also a mood component to it. So, when we're thinking about ODD, there is a component of an angry and irritable mood dimension, not just that behavioral saying no. In the video I showed, you even see how, even at 10 months of age, my daughter knew she was being cheeky and was given that little smile as she was shaking her head. So much more of a behavioral defiance there, as opposed to that angry, irritable mood dimension. We, of course, want to look at functional impairment. So, for the most part, when kids are being non-compliant in typical development, it's not really impacting their ability to form relationships with their peers, to interact with their caregivers, or to perform in settings like daycare or at preschool. And then we also want to look at what happens when we attempt to correct the behavior. So when we redirect the behavior, in typical development, for the most part, toddlers can be redirected with choices, with things like positive reinforcement, even just changing the tone of voice that you use when you ask them to do something. Whereas children who are on that more concerning trajectory or might be more on that ODD spectrum tend to be more resistant to those standard strategies. Behavior number 3, aggression, specifically physical aggression. We tend to see disruptive behavior like hitting, biting, pushing in the toddler years, right? And these aggressive behaviors often co-occur with things like temper tantrums and defiance, but they don't have to. They can be independent of themselves. But they'll typically be at their peak in early toddlerhood. And then by the time a child starts to enter school, we tend to see a decrease in these behaviors. Again, very common. Between 6 to 24 months of age, in fact, 94% of kids are reported to have engaged in some sort of physically aggressive behavior within the last month. And when we think about physical aggression in typical development, it tends to be a reactive process. So it's often driven by a child becoming frustrated, often at, like I said, this language gap where they have the ability to understand the situation and the context, but that limited ability to express their frustration. And so often these behaviors like hitting, biting, pushing are the child's way of communicating that lack of acceptance of the particular situation. So it's often not a proactive behavior, though it can be. When are aggressive behaviors concerning? When we look at the frequency, and again, we're seeing these aggressive behaviors occur on an almost daily basis or several times per day. That's a lot more concerning. The severity of the behavior. So when we're seeing significant harm being caused to others. So there's a pretty big difference when you bite, but you don't actually bite down and make a mark or break skin on somebody versus when you are actually chomping down and blood is shedding, things like that. We're also looking across that different setting again. So, is this occurring regardless of where the child is at, when they're at daycare, when they're with different people, when they're at home, etc. Again, that trajectory of the behavior. So, a common trend across these challenging behaviors in the toddler years is that typically by the time they're getting to 3 or 4 years of age, we want to see some sort of decline in the behavior. Decline doesn't mean 0 instances of the behavior, it means decline, but that's the pattern that we're looking for. And then, of course, aggression also has an additional concern when there are co-occurring risk factors with the aggressive behaviors. So these can be things like having harsher parenting styles, using corporal punishment, for example, or having a child who has a more challenging temperament. Those things could lead to referrals for intervention. Okay. Our next behavior is separation anxiety. And separation difficulty and stranger anxiety are, again, really expected developmental milestones. And they occur commonly in that first year of life and then going into the second year, so between 6 to 15 months. It goes along with the development of secure attachment and trust. We actually think of anxiety when we're looking at attachment styles as being a positive thing. And between 1.5 and 6 years of age, there tend to be 4 distinct trajectories of separation anxiety. Low persistent separation anxiety tend to form the majority of children who show some symptoms of separation anxiety. This is kind of the most typical presentation of separation anxiety, meaning that there is some anxiousness around that separation from caregiver, but there's minimal symptoms. A second pattern is the, minimal symptoms, but they are increasing as the child ages. So the symptoms may be emerging a little bit later in development, but they tend to, again, resolve by about age 6. We also see a pattern where we're going to have really high levels of early separation anxiety in about 10% of children that then decrease over time. So some children are just a lot more anxious in their early child years when it comes to that separating from their caregiver, but they have this progressive decline in that separation anxiety, and it tends to resolve almost fully by age 4 and 5. And then lastly, we have the pattern of high increasing. So this is the trajectory really that predicts the most separation anxiety later on. Most children who have really high separation anxiety at 1.5 are expected to kind of recover by 4 to 5. But this high increasing group, which is often associated with factors like higher maternal depression, even maternal smoking during pregnancy and parental unemployment, they tend to start high and then increase over time. And it may actually predict the differentiation of a separation anxiety disorder later in life. So when we think of separation anxiety as being clinically significant, is that while this separation from a caregiver is a really normative fear in toddlers, the thing that really makes it into a separation disorder is when it's developmentally inappropriate, as well as when it is accompanied by this excessive worry or distress upon the separation. There is clinically significant functional impairment. Examples of functional impairment might range from having specific fears of experiencing an adverse event like getting lost, being kidnapped, being ill. We also might see behaviors like refusing to leave the home, or things like sleep disturbance. So a child might be refusing to sleep away from the caregiver or away from the home. They also might experience fears of being alone. And then, more importantly, the separation anxiety not only kind of follows these first three patterns here, but in children with a true separation anxiety disorder, these behaviors are really persistent and are present consistently for a minimum of 4 weeks in young children. Lastly, we have inattention and hyperactivity. Inattentive, hyperactive, and impulsive behaviors are developmentally expected in toddlers. Some developmentally appropriate behaviors include having a short attention span or shifting rapidly between activities every few minutes. Typically, sustained attention to a single task develops more gradually during the preschool years. Toddlers are also naturally distractible. They're drawn to novel stimuli and have really limited ability to filter out extraneous input. Toddlers have difficulty following multi-step instructions. A lot of times, this is actually more reflective of cognitive and language development as opposed to pathology, like we would see in a child with ADHD. Toddlers are also inconsistent listeners. They might appear not to hear things when they're absorbed in play, and that's pretty typical at this age. They can be really active. They're often running, climbing, and having a difficult time sitting still. And those are, again, things that we expect and often are reflective of bursts of development in motor skills. Children, as we've touched on earlier, are also quite impulsive during this age. They might grab objects, have difficulty waiting their turn, or act without thinking. And this, again, is really linking back to that immature prefrontal cortex function. They have difficulty with turn taking and sharing. Again, social skill development around that is still actively developing. And then we often will also see excessive talking or interrupting during this stage, which can be reflective of these gains that they've made in their expressive language skills, occurring alongside that limited ability to regulate themselves. So when is it ADHD? Well, when we're talking about really young children, especially before age 4, that's pretty difficult to determine. As you saw, a lot of these behaviors that are actually reflective of ADHD are typically developing processes in early childhood development. So it's hard to say prior to age 4 whether or not what we're capturing with these behaviors is a difficulty with sustained attention that meets that clinical threshold for ADHD, or if it's a typically developing typical developmental process. We're going to look at the intensity, of course. So we want to see it happen more than their peers do. So using that peer-to-peer comparison or being more really unmanageable gets at that intensity. It's really important when we're assessing for attentional difficulties and hyperactive behaviors to see these things in different settings. So we have to demonstrate that there really is this impairment in regardless of where the child is interacting. So when they're at school and when they're at home, we're both seeing those difficulties sustaining attention. We also want to see that, like, when we try behavior management strategies, we're not getting a lot of improvement, and that this is being demonstrated for more than 6 months at a time. Impairment, it often looks like difficulty making and keeping friends, difficulty sustaining attention for learning or on non-preferred tasks, and then also engaging in behaviors that might put their safety at risk. And then, especially for kids who might be more active toddlers, we tend to see their trajectory either remain stable over time or actually worsen. So when we're looking at those peer-to-peer comparisons, we're going to see a gap start to widen as their peers start to learn to regulate their behaviors, and the child with ADHD might have more difficulty there. So for the last few bits, I just want to talk through some strategies for managing challenging behavior and challenging moments. Some basic caregiver behavior strategies that you can that have been effective for especially managing these more challenging situations in the toddler years are things like focusing on setting healthy limits. So having really clear, consistent, age-appropriate boundaries. Um, Embracing routines and structure. Predictability is a big thing for toddlers. The more they understand what's going to happen, that helps to kind of bridge that gap between the difference in what they understand about their world and what they can express. So it reduces that behavioral dysregulation. Providing and really embracing the desire for autonomy. So I coach a lot in my parent training sessions with families about how the more we can really lean into this desire for autonomy that toddlers naturally have, the more in control of their world that they'll feel. And our job as caregivers is not necessarily to make those decisions for them, but again, to kind of pair this with that healthy limit setting, set those appropriate boundaries for them, but allow the child the autonomy to choose which path they take forward. So we need them to get to the bath. It doesn't really matter if they crawl like a bear to the bathtub or if they hop like a bunny, right? At the end of the day, they're in the bathtub. And just little opportunities like that embrace that desire for independence and autonomy can be game changers when it comes to managing more challenging moments. Providing specific immediate rewards, reinforcing desired behavior really close in time to when it happens, cannot be understated here. So having a plan for when you see, those positive behaviors that you want to see, how are you going to make sure that those get reinforced? And we'll talk about that here a little bit more in depth in a minute. Time out balanced with time in. This is a big one for me because I think time out becomes kind of this go-to consequence strategy that's used in toddlerhood. And oftentimes it comes at the expense of these positive interactions with our child. So we lean more heavily on these consequence or punishment-based strategies and not enough on the more positive time in. So really what this is trying to say is that like if we're going to do something like remove reinforcement for a particular behavior, say like you pick up a toy and you slug your brother with it, and we say, all right, well that toy's out of play now. So we essentially give the time out to the object. We also want to make sure that that's being balanced with dedicated special time and attention for those positive behaviors, especially with the caregiver. So we talk a lot about making sure that there's time carved out to do that like child-led play, and that can be a nice balance there. Additionally, when it comes to consequences, making sure they're logical and they're natural consequences. As caregivers, it's a tendency to, say like, oh, you hit your brother, you can't watch TV. Well, what do those two things really have to do with one another? Not a whole heck of a lot, right? So we want to make sure that the consequences that we're using, especially for children with these limited language abilities, make sense to the context. So if you hit your brother's not going to play with you. That's a natural, logical consequence. So maybe you're going to miss out on the fact that mom and brother are going to go play together and you're not included in that play. And then bridging that communication barrier. So utilizing visuals or modeling based strategies to help communicate anything that might be a change in routine or schedule or establish a routine. So we can lean on strategies like utilizing visual schedules. Here are some simple examples here. I always like to teach caregivers about making sure that something fun is on the visual schedule. We don't want it just to be the hard things. So after we eat our dinner and we brush our teeth, then we get to use our tablet is a great example of a visual. Positive reinforcement is anything really that's going to follow a behavior that's going to increase the likelihood of the behavior occurring in the future. So we want to make sure that we utilize positive reinforcement for behaviors that we actually want to see again. So recognizing, giving that focused, positive attention, and rewarding those desired behaviors to encourage that repetition. I often get asked or have concerns expressed by caregivers about, like, well, you're talking about bribing my child to do something. And so I think it's always worthwhile to do a little teaching moment on the difference between bribery versus reinforcement. And it's a subtle difference, but it's a meaningful difference. And essentially, the difference is when the reinforcer is offered. So, in reinforcement, what we are essentially doing is establishing a contract between a behavior and the outcome of that particular behavior. So, if you put your clothes in your hamper, then you will earn a quarter, right? There's a direct link between the behavior and what the outcome of that behavior is going to be. It's also premeditated. So we are giving that behavioral contingency ahead of time, and we're also letting the child know what the result of that behavior is going to be ahead of time. Whereas when we start to turn the tables more towards bribery, is when what we do first is just give the child an instruction. So we say, put your clothes in the hamper. And most kids, upon hearing something that they don't want to do, especially if they're having to transition away from a fun activity, are going to say, no, you can't make me put my clothes in my hamper, right? So then we say something like, if you put your clothes in your hamper, I'll give you a quarter. We're offering the same reinforcer, right? The difference, though, is the timing. We are now offering it in response to a challenging behavior. That's saying no, or you can't make me. That is when we're crossing that threshold into bribing. So we always want to lean more on that first example, that reinforcement, setting that contract ahead of stage, because that is going to ultimately reduce or result in more changed behavior, as opposed to bribery, where we tend to just pick things out willy-nilly and we're not as consistent with them. Benefits to positive reinforcement are that they're really focused on the desired behavior. So we're not talking anymore about the behavior that we don't want to see. We're talking about the behavior that we do want to see. And we're giving all of our attention to that particular behavior. Positive reinforcement is also a habit builder. As human beings, we often are not intrinsically motivated to do things, right? Like, I might desire being more physically fit. And so I might tell myself something like, okay, Ashley, if you go to the gym 3 times this week, then you can order pizza on Friday, right? And so I lug myself to the gym 3 times that week. And then on Friday, I'm like, yes, you did it. You can have your pizza. Over time, what I'm doing is, by repeating that positive behavior of going to the gym, I become less reliant on this external motivator of ordering the pizza. Was it necessary to get me going? Maybe, probably, definitely, right? But over time, it just becomes something that I do. It develops into a habit. And I find that giving examples like that to caregivers really helps them to understand why reinforcement can be really important. It is essentially a way of developing this behavior that they really want their child to have, which is like, well, shouldn't they just want to clean their room? Sure, in a perfect world, that would be great. I don't think that describes most of us, right? So to get there to that point where we just clean our room because it's something that we do, we have to sometimes rely on these external motivators. It also really strengthens relationships between caregivers and children when we are providing lots of positive reinforcement. Essentially, the child's getting the attention for the good things that they're doing. They're getting all of this care and attention from their families for the things that we want them to get care and attention for. And it helps them to learn what behaviors are desired in the context of the home. Here are just some examples of different types of positive reinforcement. Really, what I like to emphasize with this particular slide is that first bullet point there, which is natural consequences. Just like when I talked about when it comes to punishment type strategies, we want them to be directly linked to the behavior. It can be really helpful if when we're thinking about developing reinforcement plans, we also think of reinforcers that are natural to the environment that the child exists in. So it doesn't rely so much on having to go to the dollar store and buy more trinkets to give to your child to eventually end up in the garbage can, right? If instead we can think about things that the child enjoys that are maybe giving away freely to them right now. So, a bedtime story and getting to choose your own bedtime story for compliance with putting your pajamas on can be an example of a really great natural reinforcer. So lastly here, I'll just kind of walk through some examples of some interventions that might be helpful for some of those behaviors we went through. Um, let's talk first about transitions between preferred and non-preferred activities. We mentioned how those can be a trigger oftentimes for things like non-compliance and tantrums. So some strategies that might be helpful for caregivers are giving adequate warnings by setting timers ahead of time before that transition, giving the child's brain a chance to process the fact that something's going to change. Changing the way you ask the child to do that transition. I gave that bath example earlier. It's very different to ask a child if they want to crawl like a bear or hop like a bunny to the bath versus saying, go get in the bath, right? And so just making those subtle changes can help with transitions. Changing the order of events. So making sure that we're doing the hard things first and then we're getting to do the fun things rather than having to transition away from the fun things to do the hard things. And then providing that positive reinforcement for compliance with behavior. Let's see. I might go to this one here just for the sake of time. But essentially, when we think about separation anxiety as a particular target behavior, doing things like increasing that one-on-one time that the child gets with their caregiver can be a great intervention for managing the separation from the caregiver. So having these really predictable routines in the day where the child knows, okay, after we eat dinner every night, mom and I play a game together, or we read a book together, whatever that looks like. Caregivers modeling appropriate social interactions. How many of us have gone to a child's birthday party for a child's friend and completely ignored the adults around us, stayed on the periphery, only talked to our children? We do it all the time. That's not really modeling what we're expecting our child to be doing in that situation, right? Like we're like, go play with the kids. And without having that model, that can be really difficult and anxiety provoking. So encouraging caregivers to, introduce themselves when they're in a new setting, allow the child some time to kind of adjust to that new setting before really pushing them to integrate with other children, identifying a peer or, supporting that integration with peers by being alongside them for a bit of time and then gradually increasing that space. We also don't want to avoid situations where we're going to have to separate, right? So giving those opportunities, even if they're short. I've worked with families where we have done short separations. For example, mom says bye, drives around the block and comes back, right? And then we kind of build from there. So giving those small opportunities for the child to practice being away from their caregiver. And then letting the child know that this feeling that they're experiencing, being worried, being nervous, being anxious about their caregiver going away is normal, and that we all feel that way from time to time, and acknowledging that. Lastly, I just like to acknowledge challenging days. We all have them. And they are kind of the things that sometimes we weigh very heavily when really their impact is pretty minimal. So, as a caregiver, it's okay. And I would encourage you to give caregivers permission on those challenging days to let things slide a little bit. Maybe those aren't the days that all the toys get put away in the toy room at the end of the day. Maybe it's the day that you skip the bath. In the end, it's always better to not give a demand at all than it is to give one and end up giving in to whatever behavior you see. So manage those days. They're not going to be forever. And really stop making parenthood harder by pretending that it's not hard. So with that, I'll stop and see. I don't know if we have time for questions, but I'm happy to take some if we do, Janelle.
Yeah. So that was an excellent presentation, Ashley. And it's just a good reminder too, right? That parenting is hard. Life is hard. We all have bad days. Talking about a tantrum, I want to have one sometimes. So,
I
so
do, right?
right. Hopefully in a more appropriate way than laying on the ground, but
Yes, yeah. Depends on the day.
right. If anybody has a question or a comment, Pat, I see you looking for your unmute button.
Well, it's just hilarious because, I obviously raised two children and they're perfect, but I have a 27-month-old grandson who I spent the last all weekend with, and he's perfect too, but it's lovely to just reiterate just how typical he is.
Yeah.
So, thank you.
Yes, those hard days are typical.
Well, I had no hard days. He was great.
Spoken like a true grandmother, I would say.
I think maybe, Pat, it was the kids who had hard days, not you. Hey, I did want to say, Ashley, thank you for this presentation. I know we have a lot of Part C early intervention providers on this call, and what a great resource to be able to take out to families with challenging behaviors, because I know some programs have behavior specialists, some programs don't. But after listening to you and you identifying those 5 major behaviors and how to work with them, and especially that last part where you really talked about the balance between time out and time in, and it was just masterful. You did such a great job. What a great resource for those Part C providers that are on here, that when you have a family that needs those resources. As a physical therapist, I lean on my dad role that more than my professional role when I start talking about behaviors. And I try not to play in that area too much because I am not an expert at it. But this would be just such a great resource to be able to share with the families that we have difficult times with. So thank you for presenting it in such a research informed, but still a very understandable way. I appreciate it a lot. Thank you so much.
Well, thank you.
Okay, so there is one question. Who do you recommend that a parent seek after the age of 3 for some of the challenging behaviors?
Yeah, so I think in that situation where you have a caregiver who is expressing more concern and they've aged out of your system, that might be the time to reach out to family therapists, mental health counselors, especially programs that are doing more of a family-based approach to challenging behaviors. So parent-child interaction therapy is often really helpful in these early years. Any sort of positive parenting program. And I would be happy to share some resources with Janelle to distribute to the group.
Great.
Yeah.
Thank you.
Pediatricians are also really great. So
pediatricians, yes, they are really great.
Yeah.
Hey, well,
thanks
we
for
are
having me back.
Thank you. Thank you. Thank you. It won't be the last time, Ashley. So
I hope not. You always challenge me to take a new angle, so I love it.
hey. All right. We are going to move on to our case. So our case today is hopefully to look at some of that typical development as well as how do we help families understand atypical development. So this is Luca, and he is a 20-month-old. He lives at home with his parents and an older sibling, and he attends daycare for 3 mornings a week. The daycare is saying, telling parents they are seeing more frequent meltdowns, especially during transitions and moments of frustration. Parents are not seeing that at home, and so they really are wondering what is happening. He was a full-term baby with no medical complications. He met all of his milestones except for language, and he's described as kind of an easy child, easy baby. So again, what the daycare is reporting is that he is having frequent meltdowns. And what those meltdowns mean, they can't really describe that to parents, but they are just noticing that. He is having those happen when he's transitioning, when he's being told no, or is experiencing some sensory overload. So lots of noise or a lot of kids. He does use a few words, but right now he's mostly communicating through gestures, sounds, or crying. Daycare is saying that he has difficulty following group routines, like going to the snack table or circle time. He really enjoys some of those cause and effect toys. At home, things are feeling a little bit easier and the routines are more consistent, is one of the things that parents are sharing. Um, so Luca also really has some great strengths. He does really engage with familiar adults. He seeks adults out when he's distressed. He does show joy and focus during preferred play activities, and he's responsive to caregivers who are attentive and engaged to him. So the parents' question to the daycare and to others is this just typical toddler behavior, or should we be paying closer attention? What support can we offer now, and how do we know when to take these next steps? So as we're going into our breakout rooms, I mean, Ashley set that up really nicely today of saying, is this typical or is this atypical when we're thinking about behavior? So, and we've probably all experienced a family that has been asking us these questions about development or about behavior. And how do we handle that? So some of the questions, each breakout group is going to be answering these questions. Hub members should have gotten in chat what their case questions are. And so we'll go ahead and move into breakout rooms, and then we'll come back in about 1:20 and have some further discussion. Great. Well, we have just a few minutes to go over ideas. So, Kurt, your group.
Yeah, we had a question about environmental expectations and expectations, home versus childcare. What influence does that have, and what support can be tried? And I think we talked a lot about the consistency with kids, making sure that schedules are consistent, orders of things are consistent, that we help the kids recognize that there's going to be a change coming up so they can prepare for that change. And then also just good communication with the parents. Did the kid have a rotten day in the morning? What does it look like on days when the kid isn't in daycare? And those kind of things, just having that good communication. It'll all be there on Canvas. So some really, really good suggestions in the group today.
Great. Kate. I don't know whose group everybody was in, so I'm just calling on our hub members. And so if you were in Kurt's group, you can just say that.
No, I wasn't, but I was with Leo who took notes, so I don't know if he wants to.
I
Okay,
can share. It's
Leo.
okay.
Thank you, Leo.
Yeah. We talked a lot about maybe focusing on more of the sensory route and seeing if maybe the client is having sensory issues at daycare versus at home, just because the discrepancies of behavior between home versus daycare is maybe a bit alarming. If he's having frequent meltdowns at daycare, is he having those frequent meltdowns at home, or have they just started having frequent meltdowns at home? So perhaps it did pose a bit more of questions, but we kind of just honed in on more of focusing on the sensory because if he's already doing really great at home, then perhaps there could be some environmental changes at daycare that could be implemented for him to have a just better day.
Great. Those are wonderful suggestions. Okay, Shelby. Again, don't know whose group you were in. Don't know if you
Oh,
took notes.
no, we're good. Yep. Um, our group talked a lot about the relationship between the daycare providers and the parents, and kind of just wondering what the communication is like, whether communication is understood between all parties, um, knowing maybe a more descriptive explanation of what the behaviors are looking like and how daycare providers are responding to the behaviors. Um, but yeah, a lot of our conversation was about the relationship between parents and daycare providers and making sure that there's a positive relationship that will kind of transfer over to the daycare and home settings between all parties.
Yeah, I think that's a really valid point too, because a lot of times we just get these conversations from families and helping them understand that you need to have those conversations with your daycare or you how do you go about approaching those? So great. Kirsten, were you in another group or did your group go?
I was with Shelby.
Okay. Okay, Pat, did your group go or
I was with the marvelous Kurt.
okay, all
Janelle, I
right.
think it should just be your group if you
Okay,
have not shared.
so our group, a lot of things that we talked about. So we had a question about how do we talk to families in a way that feels supportive and not alarming. And so people talked about like pointing out the good things that the parent is doing, how normal some of those behaviors that their child is experiencing is that they're normal on that and being able to stay calm, using more of a strength-based approach and trying to be positive and meet families where they are in the process. So some really great discussions that happened in the group. Again, we do compile all of these. We've all had a family that probably sounds pretty similar to this case, little Mr. Lucas. And so go back and look at what everybody has shared. It's always hard to come back from breakout groups and have those deep discussions that we were just having. Amazing. So again, our next session will be June 3rd. And it is going to be on social emotional development and how to support families in that aspect. So thank you all for joining. We will see you next month.